A 22-year-old professional softball player is undergoing an annual check-up. The medical history is significantly for hallux valgus and scoliosis. The family history is significant for heart disease. The blood pressure is 110 versus 70 millimeter Hg. The heart rate is 78 per minute, and the respiratory rate is 15 per minute. The physical exam was unremarkable except for an indurated palpable mass on the left breast. A biopsy of the mass is ordered, which biopsy findings are most likely to be present in this patient. Option A, chronic inflammation with plasma cells. B, necrotic fat with calcification and giant cells. C, leaf-like projections. D, duct-like structures. E, abundant extracellular mucin. Correct answer is B. Necrosis of breast fat is usually related to trauma, which was likely caused during softball practice in this patient and is a benign condition. The related findings include an indurated painless mass on physical examination or abnormal calcification on mammography. Biopsy of the mass will show necrotic fat with calcification. For example, saponification and giant cells. Treatment is not required. Breast pathologies. A. Inflammatory conditions. Acute mastitis. Bacterial infection due to Staphylococcus aureus. Treatment consists of drainage and antibiotics. Periductal mastitis. Inflammation of the subareolar ducts, common in smokers. Mammary duct ectasia. Inflammation with dilation of the subareolar ducts, common in multiparous postmenopausal women. Green-blown nipple discharge. Fat necrosis. Necrosis of breast adipose tissue related to trauma. Mammography shows calcification. B. Benign tumors. Fibrocystic change. Most common change in premenopausal women, commonly in the upper outer quadrant. Intraductal papilloma. Papillary growth into a large duct, presents as a bloody nipple discharge in premenopause women. Fibroadenoma, fibrous tissue and gland tumor, mobile marble-sized mass, estrogen sensitive. Phyllodes tumor, fibrous tissue overgrowth, leaf-like projections saw in the biopsy. C. Breast cancer, ductal carcinoma in situ, proliferation of duct cells but no changes in the basement membrane. Usually does not form a mass. A subtype is Paget disease, which is DCIS, that also involves the skin of the nipple. Invasive ductal carcinoma, clinically detected as a mass, dimpling of the skin or retraction of the nipple occurs in advanced cases. Biopsy shows duct-like structures in the desmoplastic stroma. Lobular carcinoma in situ, no involvement of the basement membrane. Cells proliferate in lobules, does not produce a mass. Characteristic loss of cellular adhesion due to a lack of E-cadherin adhesion protein. Invasive lobular carcinoma, single file pattern growth. Cells exhibit a cygnet ring morphology, contains E-cadherin. Option A. Mammary duct ectasia. Ectasia is an inflammatory process with dilation of the subareolar ducts. Clinically, mammary duct ectasia presents as a periareolar mass with a green-brown nipple discharge, which represents inflammatory debris. A biopsy reveals chronic inflammation with plasma cells. Option C. Phyllodes tumor is a benign fibroadenoma-like tumor with overgrowth of the fibrous component. Classically occurring in postmenopausal women. Characteristic leaf-like projections are observed in the biopsy. Treatment is by white excision. Option D. Invasive ductal carcinoma is the most common type of invasive breast carcinoma. Advanced cases can retract the nipple skin, resulting in dimpling of the skin. Biopsy reveals duct-like structures in a desmoplastic stroma. Subtypes include tubular, mucinous, medullary, and inflammatory carcinomas. Option E. Abundant extracellular mucin is noted in mucinous invasive ductal carcinoma. Tumor cells floating in a mucus pool. This finding would be unlikely in a 22-year-old woman. Learning objective. Breast trauma can lead to necrosis of breast fat, a benign condition that frequently occurs in patients involved in contact sports. An indurated palpable mass can be identified during the exam. A biopsy will show necrotic fat with calcifications and giant cells. Treatment is not required.